Next, we will hear from Dr. Yulia Carroll, the Associate Director for Science at the Division for Environmental Health Science and Practice at the Centers for Disease Control and Prevention, where she advises on various climate and environmental health issues. The division's climate and health program supports state, tribal, local, and territorial public health agencies as they prepare for the health impacts of a changing climate. We're so grateful she's with us today to share more about CDC's leadership on this topic. Dr. Carroll?
Thank you very much for this introduction. And I would like go to the next slide. If I can have this next slide, that would be great. As Dr. Clayton described, mental illness is one of the major causes of suffering in the United States, and extreme weather events can affect mental health in several ways. So this is a graphic that we often present, but the reason is that the arrows in the center reading rising temperatures, more extreme weather, rising sea level, and increasing CO2 levels represent some of the direct effects of climate change. And going from these drivers in the middle, you see how we have a variety of health impacts, one of them being mental health, of course, a very important part of climate change and its effect on human health. Next slide, please. So by addressing the drivers in the middles of the circle showed in the previous slide, we can also address mental health. So the challenge is, how do we address these problems and how do we move to adapt to a changing climate that is already causing these things to occur? Next slide, please. So today I am going to talk about the Climate and Health Program at the Centers for Disease Control and Prevention. We have been in existence and funded by Congress since 2009, and we are the only federal government investment in designing and building climate change capabilities for the local health departments. Much of our work is really on building resilience to the health effects of climate change at the states and the local jurisdictions. We have 4 objectives: to serve as a resource for federal, state, local, and tribal health agencies by providing technical assistance and identifying and showcasing promising practices. We also prepare public health practitioners to address the health effects of climate change. We provide tools, guides, and processes to help assess vulnerability to possible health effects. We develop and distribute guidance and integrate information from many sources. And finally, we serve as a reliable leader in planning for public health effects of climate change. Next slide, please. So here, I want to present how over more than 10 years, we have funded jurisdictions across a wide geographical range. This is a map of both current and historic CDC climate health grantees. So the climate impacts vary by location. For example, coastal areas may be worried about health impacts of sea level rise, while northeastern and midwestern areas might be tracking the influence of temperature on tick distribution. So it is really critical that we develop capacity around the country, and we have done this by funding and providing technical assistance to states, but also to tribes, territories, cities, and counties. So we have been funding tribes since 2016, and we have funded since then 9 tribes and 3 territories, and have been working in partnership with the National Indian Health Board and the Association of State and Territorial Health Officials. Currently, in our current funding cycle, we're funding 9 states and 2 city health departments to prepare for the health effects of climate change. And the focus of 2021 grantees is to implement and evaluate the adaptations that can be identified, developed, and implemented to minimize the health effects that are already occurring. So in this slide that you're seeing right now, I also wanted to show some other work that we have been doing because climate change is projected to increase the frequency of natural disasters and increase their intensity, and CDC is a crucial partner with the states for both preparedness, prevention, and post activities, providing technical assistance. We do provide situational awareness through rapid needs assessments, and these are some examples where we have provided mental and behavioral health during a variety of disasters, but also we have assessed mental needs in the post-recovery period. And it has been great in identifying resource limitations and making sure that the priorities of the communities are met, and also there is a basis for interventions and they have been followed up. We have more information on this on our website. Another way that we assist with mental health is through the vast source of CDC surveillance data. One such example is the behavioral risk factor surveillance system. So it contains depression and anxiety modules. And most recently, we have been studying those in relation to exposure to wildfire smoke and self-reported symptoms affecting mental health in Oregon, which is an area often affected by wildfires. So next, I will present the work that CDC does to increase community resilience to climate change, and I will give you some specific examples. Next slide, please. So in the next slide, the actions taken to address climate change are thought to fall in two buckets. One is adaptation, which is managing the impacts of climate change with the goal of being less vulnerable, more resilient. And the other is mitigation, which is about reducing the emissions of greenhouse gases that make climate change worse. And there are actions that can be taken that both reduce emissions that cause climate change and increase health and preparedness at the same time. And such an example is alternative transportation, such as taking public transit or riding a bike. That reduces both carbon emissions, but also improves health, including mental health, physical mobility. And I'm going to now move to next slide, where I will want to talk to you about the CDC Building Resilience Against Climate Effects framework. So we use this framework when we fund our states or tribes or local health departments as the 5-step process that helps them identify strategies and programs to build a coordinated community response for adapting to the health effects of climate change. So in the first steps, the health departments or local communities identify what climate effects are relevant locally, how those might lead to new or expanded health threats, including mental, and who is most at risk. The next step is to calculate the expected impacts on the local population and rank the severity of each threat. This is the projecting the disease burden, and what it does is helps health officials tackle the worst risks first. And then in step 3, they can identify ways the community can intervene to prevent or reduce health effects. For example, health officials who are expecting more high heat days might consider if it would be more effective to open community cooling centers or to collaborate on housing and development plans to protect vulnerable residents. In step 4, health officials work with other community sectors to develop and implement their plan. This is a very communicative, collaborative way where health officials work with city planners to reduce impacts of urban heat islands, or they can work with broadcast meteorologists to alert people to prepare for extreme weather. And in step 5 is evaluations where we assess the success, our lessons learned, and how we can apply it for future activities. Next slide, please. So here I just want to highlight one of our many reports. Here we looked in the regional health impacts of climate change in the United States. We published this report in 2020. It looked at 7 health domains, including mental health in the different regions of the United States. And as Dr. Clayton said, like in different regions, we are going to also look at slightly different mental health impacts. For example, in Alaska, the Native Americans being relying on their subsistence foods, their culture and traditional knowledge being much more linked to environment, and of course the effects of potential relocation from long-established traditional sites due to climate change are associated with feelings of depression, with increased substance abuse and other mental health effects. While in the Midwest, the mental stress follows flooding events. Those are, of course, associated also with substantial health impacts identified as sleepiness, anxiety, depression, post-traumatic stress disorder. But this is just an example of a report where we try to look at the different regions by different environmental climate change stressors and mental health and other issues localized and how they can be addressed. Next slide, please. So it is important to know there is no single solution to solve the climate crisis, and That is why understanding the climate impacts, the community circumstances is important, and that's why we use it in our BRACE framework. We have a lot of different adaptations plans, whether for state, others are for cities, for tribes. We have them even for sector, water, and transportation. Next slide, please. In addition, we have developed a variety of documents on how to plan and adapt to a changing climate. So these are resources for both health professionals, but we also have for general public. We have fact sheets for health departments, how to incorporate climate resilience. We especially focus on how to help health departments with limited staff and resources to adapt to those. We provide a lot of communication materials. We even identified partners, local partners in the community, how to approach them or what their role is. We provide a lot of different examples of health harms, what are the most vulnerable populations, and examples of success stories and how this can be applied to you. So I want to also touch base in my next slides, please, on a few examples of what CDC funded recipients have done. So we have many more examples, but for this time, I'm just going to focus on 3. So again, as Dr. Clayton said, heat is really one of well-identified associations with where mental illness patients are especially susceptible. As she said, we have suicide rates increase. We have a lot of risk during hot weather with a variety of illnesses. So that's why I wanted to highlight the New York City example of how they addressed extreme heat. And in this case, they identified that communities of low socioeconomic status faced increased risk of heat-related illness and death as there is less access or use of air conditioning in the home. So the New York City Climate and Health Department implemented the BUDDY program. It aimed at strengthening relationships between residents and local organizations to increase resilience to extreme heat. And the participating community organizations received trainings on heat, health, emergency preparedness, voluntary management. They were able, during an extreme heat event, to identify and reach residents at the greatest risk. So just for example, during the first 90 months of the project, 17 events were activated. A network of 64 trained volunteers reached 454 residents. And this project had a long-lasting impact as it strengthened the connections between the local organizations and the residents. And, community feeling is very important also for addressing mental health issues. So in the next slide, I wanted to highlight more resources that CDC has developed. In our environmental public health tracking portal, we have this heat and health tracking program where specifically focused on heat. So, other states and grantees have opened more centers with air conditioning during heat waves, more identified vulnerable areas by using these tools or their own resources. But this is just example where you can compare, anyone can have access and compare, for example, heat days on one side and population age 65 and above. So you can see in one place where you can have vulnerable population in which days. On this side, we also forecast in the future the monthly heat waves. You can identify again where this will be more impacted, and we also provide sources of how to deal with it. So in the next slide, for example, this is just a dashboard where different vulnerabilities are identified, different groups. But also on this website, you can see when and where to activate or close cooling centers, where they're located, to predict if heat seasons are going to start earlier. Again, who and where does the most vulnerable populations live, is provide resources specific to your area, and more resources from CDC. Next slide, please. This is from a tribe in Alaska, where thick ice in the winter is used for transportation by snowmobiles, and the warming has caused thinning of ice, which has created hazardous travel conditions, increased the number of instances that people fall through the ice. So in the tribal village of Wainwright in Alaska, funding from the Climate Health Program supported the distribution of InReach devices, which are used for emergency communication when snowmobiles get stuck in thin ice and people are stranded. So it improved community awareness of the hazards of thin ice, equipped them with life-saving communication devices, and also helped with reduction in helicopter rescue funding. And the final slide is how Florida is protecting residents during hurricane season, which are, hurricanes are getting more and more with longer seasons. So Florida is really more prone to flooding with increased need and use of emergency shelters. So what the Florida Department of Health did is they evaluated the emergency shelter use and whether they were sufficiently serving individuals with disabilities. So this evaluation led to a collaboration with FEMA and the Red Cross, and they implemented changes to really make communication and operation of emergency shelters to be more equitable in access for those with disabilities. So, and in my last slide, I just want to highlight the majority of resources we have. So this is from our coping with a disaster or traumatic event. So this is specifically during disasters, resources for children, from communities, for leaders. We have much more in-depth information if you want on all of our data, statistical resources, communication efforts, partnerships. So I'm going to leave you with my last slide, which is the general website for our climate and health program and our email, where you can reach us, ask for local community assistance or any advice and any follow-up questions we can not address today. Thank you.
Thank you, Dr. Carroll, for sharing these solutions and resources to mitigate the mental health risks associated with climate change.